The population of Bulawayo, Zimbabwe's second largest city, has been growing exponentially over the last few decades, with the local authority estimating the city's population to be around 1.2 million. This is double the 2012 census figures, which put the city's population at 653,337. The growth in population size has not been matched with adequate social amenities, especially in the health sector. The local authority runs 20 clinics and Thorngrove Infectious Diseases Hospital in the city's 29 wards. Access to primary health care remains a challenge, with some residents forced to walk long distances to their nearest clinic. Mazwi Village is one of the areas which does not have a clinic of its own, forcing residents in the area to access basic health care in clinics from neighboring suburbs such as Phumula. Villagers say they incur transport costs as they have to commute to the neighboring suburbs.
Sila indawo yethu naleya ilasibhedlela silasibhedlela ngoba isibhedlela esisebenzisayo iphumula kuphela. Ikame siyabe sicela nje uncedo kodwa isibhedlela sabetshele. Iklinika yesihlukuluza kakhulu ngoba ungagulelwa ngumntwana uyabunga la mali. Njengangathi kuyona le amalanga la adlulile sokule 2 weeks ngigulelwe ngumzukulu kwami lokho. Kuchisile sibili kakhulu ngaze ngafika ekhona ngale ephumula. So engifike khona ngale ephumula ngisuke lapha ngenyawo. Ngaze ngadojwa imoto sengichapha ibridge. Wabona ubaba lwani ukuthi umntwana uyachisa kakhulu. Wanthatha wazwantshiya eclinic. Ngokubona ukugula komntwana kodwa ngimbelethile ngihamba ngenyawo ngalamali. Yikho kusiphatha kabuhlungu kakhulu ngoba indawo le asikwazi ukuthi kuze kube le clinic singenza njani. Ngoba ngaze sikhulume lawo ukansela wethu. Ukansela uyathatha iklinika le buya kanye eyabantwana. Yiyo abathatha babona ngani iklinika le yoncedo. Kade ayila ncedo yabe ibuya kuphela izowe abantwana. Yabe ngala mithi kungala lutho. Izowe abantwana kuphela. Iklinika yesifuna kakhulu. Ngoba sila clinic mazuzu child ikhanda kathethe ukuzuzu yefike ephumula welatshwe yikho kusihlukuluza kakhulu singabantu badala sikhona.
Mrs Ngwenya ihlala khona apha eMazwi. Lapha vele khona akula clinic esiqondane layo. Iklinika eba khona i-mobile clinic eyabisuka ephumula ibuya la ihlangene le sizo lwethu clinic. So i-clinic i-mobile clinic le buya la okakhulu ilanda abantwana i-baby clinic. Ukwelapha abantu abadala abayelaphi kangakho. Isizo lwethu vele yena uyabelanda ogogo labana abala BP yabe buya kuphela lamaphilisi abantu abale BP lama ulcer. Ngathi kuphela anganika bona labo sokukwanile. So thina ngokwethu lapha esigabeni lesasila clinic. I-clinic akade sisebenzisa i-clinic eKhami prison. So kule nsuku eKhami prison kabasavumi. Last time lapho engcine khona ukuya eclinic sikade sihambisa abantwana lokungabatwana ungama twins engugcinayo lo mama wakho la umama wakho waxoxwa umgogo wakhe. So wabuya wazohlala lami babuye bebancane bengakahlali bafunda ukuhlala bakhasa kade sisebehamba. So abantwana laba bagula omunye waba lethumba. Ngahamba eclinic sahamba la samthwala ekseni ngemoto safika bamtreata sibili. Sithe sibuyela eseqedile ikhosi yakhe. Sesibuyela laye lo munye wakhe segula futhi. Bafika bayala khona ukusivulela igate. Bathi abasayelapha abantu beMazwi. Ngaphenduka laye umntwana etshisa.
Namenda Masuku from Sizinda, which also has no clinic, who suffers from various ailments, narrates the challenges she faces to reach Chabalala Clinic, the nearest health facility to her.
Kula clinic sizini clinic khona ngoba bechabalala ubalatshwa khona kunzima ngoba vele akula nto esingayenza ngoba noma amanesi abaphakathi balutshwana ukwanisa ukuhamba i-long distance suka khona le mafletsini duze lesiporo lesane seHarare lesa uzuzofika la kusekugcineni phela uzuzofika la it's a long distance nxa ugula so abaningi vele kwenza ukutholwa ngamabhara nxa i-helpless vele engakwanisi kutholwa ngebhara kumbe laba be-TB bekuzonatha amaphilisi ubona ukuthi umuntu kakwanisi sibili but ewalk from esizinda ebuye ezonatha amaphilisi ngapha and ezalinatha engadlanga.
She also has to sit in long queues due to the slow service at the clinic.
So abantwana babe sebelambile sebefuna ukudla lathi thina abadala njengoba singabantu abaphila ngamaphilisi yabo sulambile ngenxa yequeue kwesinye isikhathi uyithola khona lapha emaklinikhi uzuthi nxa uhambe e-main hospital ngani kuba ngcono kwesinye isikhathi liyathi liselayinini khonapha emaklinikhi abantu bayagula sigula imikhuhlane etshiyeneyo kuyaba kulama-emergency cases so baza-attenda first ama-emergency cases asiyali ngoba vele kuthiwa kumele ube lozwelwa nto nxa lina libona ukuthi lingcono lowana omunye userious so sokumele angene elayinini ahlangene phambili athole i-treatment aphangiselwe ahambe ngekhaya.
However, some residents feel the local authority is doing a good job in providing health services.
Mina ngesingami vele ngathi mina lapha mina i-Princess Margaret is the best for mina ngoba mina vele angaze ngibe lohlupho so far so good ngoba they are very fast so ma ukuthi nxa bemele beye ku lunch bayakwanisa ukuthi banjani ba-ede something like 30 minutes bengakahambi ku-lunch maybe one achaye sibili but belokho benjani be-attend abantu especially omama balabantwana.
Nangumimi namambu ekliniki abamiphatha kahle ngiyabe ngibisa umntwana ukuzoweya okuhlaba babe ngiphathe kahle sibili abakaze bangihlukumise owathi
asithi maybe nxa kube le-emergency bonke besetiyeni kulalapha bazaphaphatheka yini begijima bechiya amativi but nxa kuyekuthi kukhona omunye oseleyo then after that for ama-emergencies but so far so good ama-services abo aright banga-improve khonapho kuphela.
Activist Kumbulani Maposa says the local authority has a number of gaps that need to be looked at in order for residents to acquire adequate primary health care.
Thank you. I think generally I note about two critical things. The first thing is awareness and information dissemination that helps people to understand their rights and their responsibilities in terms of the entire public health service delivery system. You know, health is very important, is very paramount. It should be the first thing in anyone's life. But currently to our people, it's like your health is the secondary or third thing. People don't prioritize their health. That's why you find people making decisions that will compromise their health. That's why you find people, the lack of their rights. You find people, if they go to a public institution like a hospital or a clinic, if they are maltreated, they can't claim their rights. They can't hold the nurse accountable. Why? Because they don't know their rights in terms of health service delivery. So I think that's the most critical issue.
The Bulawayo City Council Director of Services, Dr. Edwin Sibanda, acknowledges that the growing population in the city has put a strain on service delivery. He says the council has managed to set up mobile clinics in areas without clinics in order for the residents in those areas to access health care.
Clinics are planned for all suburbs, And where there is a plan, the plan would even be costed. As a minimum, we would be having a bill of quantities. And what comes to mind is Zamkanin, which I mentioned earlier. We have got Country Park, where not less than 2 clinics have been planned for, and the bills of quantities have been drawn up and costed. So should we get anyone today with $1 billion walks in and says wants to build clinics in the city, we will just show them the plans with the bills of quantities and costed, and we can go ahead and build this. You'll appreciate that when you're doing public health in general, it's all about covering as many people as possible with the little resources that you may be having. Mazwi village, yes, there is a plan for them. We try and reach them through an outreach program, which we had been conducting nicely with Sizolwe to Trust, an Australian-funded organization prior to the outbreak of COVID. I'm yet to see whether they have resumed or are to resume services now that there has been a slight improvement in the COVID cases. But we all know that with the population of Imazwi village, which is not very big, it would not warrant a fully fledged clinic on their own. Yes, they have to walk long distances, but they are more amenable to an outreach type of model rather than a static clinic for themselves, dedicated to themselves.
Dr. Sibanda says most of the clinic staff is overstretched, which often results in slow services.
Complaints of poor customer care in an organization the size of council with the number of staff that I referred to earlier will obviously arise, but these are by and large isolated incidents, and they are not like reflective of the hard-working, courteous healthcare staff that we have generally in council. Disciplinary action according to the code of conduct has been carried out after due processes, investigations and all in some of the cases. But we must also appreciate that these people are working under very strenuous conditions. If half of the staff is missing, so it means you are doing double the job, and people will be fatigued naturally. And when people are fatigued, are suffering from fatigue, there is a realistic chance that they may not behave appropriately. Again, that is not an excuse, but we are all doing what we can, including training in customer care.
According to Section 29 of the Zimbabwean Constitution, every individual in the country should be provided with basic healthcare services. However, members of the lesbian, gay, bisexual, transgender community often face discrimination when visiting cancer clinics. This has forced some of them to seek backdoor unsafe medical interventions due to the treatment received in public clinics.
Most of us, we face a lot of discrimination and a lot of stigma when we get there. You know, it's hard when you're entering into a public health facility, and already from the security guard at the gate, they are already giving you eyes, they're already posing questions about how you look like, how you're dressed, and it's just a struggle to access healthcare services. Even when you're inside, the focus isn't on health anymore. The focus, it's now on who you are, how you identify. So a lot of us tend to shy away from accessing public health services at the end.
When visiting a public clinic, sometimes it's very difficult from an MSM or from a gay guy like me to just walk to a public sector to go and access some services, because we're still having a stigma and discrimination around the sexuality. There are some questions whereby you're being asked, where's your girlfriend? are you gay or whatsoever. So if I'm supposed to go and access some services, sometimes I need to hide my sexuality or to hide myself or to hide my identity, pretending as if I'm a straight guy.
My name is Sikulile Precious Vanda, but people just call me Scoop. I have had some experience because as a lesbian, sometimes it's difficult, especially when you are going about Indaba. Me, when I last went to, actually it was a hospital. So it was a bit worrying for me ngoba ngangakwazi ukuthi bazafika bembuza ama questions anjani. And I did get ama questions like ingaphi indoda yakho, and when did you have last had sex, things like that. And the doctor also wanted to check ukuthi ngenisa isandla or something like that. So I had to tell him at the end of the day about my sexual orientation, because being a lesbian, when it comes to penetration and all that, some of us are. So when I told him, it became a story around the whole hospital, because I had like 15 doctors in the room.
Members of the lesbian, gay, bisexual, transgender community demanded fair treatment at public healthcare institutions.
I think if the government was to sensitize their staff, like I had said before, to sensitize doctors, nurses, I think it's more to do with, I'm sorry to say, nurses per se, because they are the ones who are mostly discriminatory when it comes to us. It's easier for when you go to a senior doctor, they can probably hear you out, but when it comes to nurses, from the start to say, okay, I'm going into the receptionist will already give you an attitude, will already discriminate you, already out you to the other nurses. So I really think we need more sensitization trainings where at least medical staff can meet up with the LGBTI community so that we can discuss about how we would want them to treat us, like even from the security guard himself or herself, to say when a man comes in but is dressed like a lady, you talk to them in a proper manner, you refer to them, you ask questions to say, okay, this is who you are, okay, be friendly. I think then we would have more of us accessing healthcare services. But the issue right now is people are scared to access healthcare services. So many of us are scared because we are running away from that discrimination, the stigma, the outing that happens there. So at least if we are to just have more people coming to say, okay, let's sit down, let's discuss strategies, way forward on how to help each other, I think it would go a long way.
First of great importance is the need to know your rights first. It's of utmost importance that communities are aware of their health rights. So one of the ways that we've been doing that is by popularizing the Patient's Charter, which is a charter that is set down by the Ministry of Health that clearly shows the rights that patients have in health facilities. So we have run copies of the Patient's Charters, which we have distributed to our communities. We have translated them into local languages, and we've put up abridged versions in health facilities so that even for those who don't have the full copy, they are able to read at their health facilities that, okay, I have a right to this, I have a right to this. But on top of their rights, it's also of importance that people know the responsibilities that they have as patients that enable them to enjoy those rights.
I would like to encourage my fellow citizens to say health is your right. We're not begging healthcare. No one is doing us a service, a favor, sorry, by providing us healthcare services. It's not a favor. They're doing their duty. So let's demand our rights. And when you are abused in the healthcare centers, non-violently claim your right. But also let's not abuse those that are in those facilities, because the abuse comes in two ways. They may abuse us or we may abuse them. I have been to clinics, for instance, where you find that people are very rude and very harsh to those medical personnel. And let's accept that these people are humans like us. They are paid little, they have human stress and strain. You know, they are operating below capacity, so that means an individual is stressed, right? Let's accept that. And then let's try to be accommodative. But also let's not lower the standard. If the standard lowers down, let's claim our rights.
Bulawayo City Council says it is working on interventions that will assist in improving their public health service delivery in local clinics.
We offer primary health care, so therefore there will be no specialists within the establishment. What we have are nurses and doctors, general practitioners. Currently I have 5 doctors and 168 registered general nurses, some of whom are midwives and others non-midwives with other qualifications such as mental health or psychiatry training.
Health is a basic and a fundamental human right, and every individual must be guaranteed access to it without having to struggle. It is also the mandate for residents to claim their health rights in order for them to receive adequate health care.